Okay, we're filming. Okay, so today we're going to start out by going through some IT band work. So this is something that I do for a lot of pregnant clients. This is also something that I do for people who have like IT band friction, that sort of thing, as well as a lot of knee issues, people with hip issues, that sort of thing. This is also what Sarah Wild refers to as Leah's IT band torture, so that is what she means. Before I work on this with anyone, I do explain that fascial work feels very different than a lot of the deep tissue work that I do. So while I say it's intense, it's a different sort of intensity. It's more of like a burning or even sometimes not quite tearing, but similar sort of feeling. One of the ways that I do describe it is almost feeling like having duct tape peeled off, or if you had a mean sibling, if they ever did the rug burn thing on your arm, similar feeling to that, but you feel better afterwards instead of worse, so it's worth doing. The nice thing too is because there is such a big neurological component with this, is people do actually feel better immediately when they're getting up, instead of one of those like, oh, I swear in a couple days you'll think this was worth it. It's something that people do tend to feel almost immediately, so it is nice to be able to have that kind of balance of like, yes, it's gonna suck, but you realize it's okay. So for this, how I'm working, it's a very slow technique. We don't want to work too fast because we can essentially have the body kind of like do the guarding sort of thing. Then a lot of fascial work and soft tissue or connective tissue work, we want to approach it a little bit slower, just so we don't get that neurological feedback that kind of essentially get freaking out. We want to avoid that. So all of the movements that I'm going to be doing today are very slow, very controlled. That said, everybody is different, so like how much time you spend on this technique is going to be different for every person, but it's not uncommon for me to spend like 5 minutes per side. Okay. Sometimes I will just do one side if they're just having an issue there. That's it. It's always a good idea to do both sides, and if so, I do tend to start on the side that is less affected just so that I can kind of ease them into it. But sometimes you just have time for the one side and you just do the side that hurts, and then just bear through it. As with a lot of stuff like this, it's you bear through it, then you feel better. So what this technique looks like is I would have them start on their side with the side we're going to be working face up. Head is going to be supported by a pillow. We want it to be nice and comfortable for them. And then I'll get you just to lift this knee for me. I'm going to give this pillow for in between there. We just want to make sure that the pelvis isn't tipped or anything like that, and the knees are nice and supported. I'm going to be working through the leg here. Okay. So I'll just ask you to straighten this knee a little bit, bringing the leg back to me. You still want them to stay nice and stacked. That way when you're pushing down, you're not like risking pushing the knee forward. Exactly, yeah. And then the third pillow is for myself. That way when I'm leaning in, I have a barrier between myself and the client, just so you're not basically like laying down on top of the person, because you know, professional boundaries. So with the hands, the contact is going to be 2 hands spread out like this, a little bit of a spread in the fingers, and you're just going to be leaning into the tissue. And with this, the explanation that works best for me is imagine that you're trying to melt into a pat of butter. So we're not pushing deep into this, we're kind of just applying that little bit of pressure, letting the tissue give, and then waiting until you feel that resistance that feels almost like a taut, like trampoline sort of feeling. So you can feel that spring back happening, but it's not like so hard that you're like pushing all the way through the tissue. And when you feel that engagement, you're gonna just tilt your body to create that pull until you feel resistance. Now you can also use a very similar movement for assessing the IT band. So a lot of times, like I'll do a little bit more movement at the beginning, and then when I do find a spot of resistance, I'll just lean into it and hold against that resistance until you feel it release. I do typically start closer to the hip, just because the part that's more intense for most people is going to be closer down to the knee. That's where you see that the symptoms happening with like IT band friction more so. So don't jump right into the worst part of it for people. And then as far as the direction of the movement, it's really just going to be up and down. I don't do a lot of side to side with this. You can do a little bit if you like, but realistically, like there's not supposed to be a lot of movement that way. We're mostly looking to improve inferior and superior movement. And again, this is one of those things that like you want to make sure, lots of feedback, but you're still doing okay. It's not too intense, especially when you do feel like that spot of resistance. Check in that it's not just too overwhelming, because we still want the nervous system to feel safe during the movements, because otherwise the body's not really going to respond the way we want it to. And so when I find that resistance, just kind of hang out there, let the body release a little bit. A big part of this is just reminding the body that like, oh yeah, this is allowed to move, it's okay, I'm not going to fall apart if I'm not completely tensed up and freaking out all the time. I'll typically work through the same spot a few different times, kind of take a break from it, go to somewhere else, come back, just to be able to reassess, see how it's responding to everything. And in order to get a little bit more torque for myself, I do find I'm kind of like bracing against the table a little bit. That way you're not having to muscle through it. It's just that little bit of twist through the body and a little bit of tilt. That way it doesn't hurt you as well.
Surprisingly relaxing.
Right? Yeah. Which is nice, because usually when they come in and ask for that torture, it's nice that they actually feel good during sometimes. And if you do want to just be a little more forceful with it, sometimes I'll rest the forearm on one hand onto the other one just to allow like that little bit of, again, not having to use muscle strength, it's using your body, making sure that it's going to be ergonomic for you as well, but you still can hold that pressure as you're pulling. Typically I will kind of like, as I'm reassessing, reaffirm for people, oh yeah, you can feel how like it's a little less resistance to move here now than it was when we first started, just reaffirming that their body is responding to things, is capable of making changes. Just because they're in pain doesn't mean they're always going to feel that way. So yeah, it's a important part for people, making sure that they know that their body is still capable of change. A lot of people come in here being like, I've hurt for a long time and I'm always gonna hurt, and you're never gonna feel better if you're thinking that way. So and then I will typically finish up with just a little bit of almost like a modified skin rolling. So I'm going for a little bit deeper than just the skin, but still getting that lift through there, letting it move against the tissues that are underneath. And this is nice because it's a technique you can use either directly on the skin or you can use it through clothing. Jeans are difficult to work through, but you can do it. Just make sure that they empty their pockets, because I have had someone forget their keys in there before and it is very uncomfortable for them. So that is the only thing I would say, but other than that, you're more than fine to do this through clothing. Yeah, so that is basics of it. I can't think of anything else to add, so yeah, that is my ITB torture.
Sarah made that sound worse than this.